Good morning, Australia. I come to you from Denver, Colorado, although I really wish I could be there in person. Australia is definitely one of my favorite places. I've been down about 8 times working in your startup ecosystem. And this morning, I want to talk to you about something that I don't think is talked about enough in the startup ecosystem and with founders and entrepreneurs. And I call this the dark side of entrepreneurship, but it's really not all that scary. We're going to talk about founder mental health risks, the unique risks that founders and entrepreneurs face that others don't, and how best to mitigate them and build yourself a resilience toolkit to get through really trying times. So I can't see any of you on my screen, so it's kind of pointless. Usually when I'm in front of a live audience, I'll say, raise your hand if you can identify with this photo. But I'm going to assume that several of you out there can identify with this feeling as entrepreneurs and as creatives and as founders, where we just feel like some days we're drowning. And you're not wrong. There was a big study that was done in 2015 at UC Berkeley, and it was a self-reporting study of people who considered themselves founders, entrepreneurs, or creatives. And what it found was that 72% of the founder group self-reported mental health issues. 49% of that same founder group reported having 1 or more lifetime mental health issues. 32% said they had 2 or more lifetime mental health issues. And then 18% reported actually having 3 or more mental health issues throughout their lifetime. This is a tragic story, among other things, but I think a really important quote. I'm guessing many, if not all of you out there listening to this or watching this are familiar with the company Reddit. And this is a quote from the co-founder of Reddit, Aaron Swartz, brilliant young man who took his own life in 2013. And although I'm not a fan of reading slides, I'll read this quote to you. "I have a lot of illnesses. I don't talk about it much for a variety of reasons. I feel ashamed to have an illness. It sounds absurd, but there is still an enormous stigma around being sick, and I don't want to use being ill as an excuse." And so a couple things jumped out at me from that quote that really fell in line with the research and the work I've been doing for the past several years in this area. And the first one was him saying, "I feel ashamed." None of us should ever feel shame for any mental or physical health condition that we have. Bipolar is no different than diabetes in terms of being a disease that needs to be treated in some way. So the shame part made me feel sad. And then also where he says there's still an enormous stigma. So shame is something that comes from within, although it can be dictated by society to some extent. But shame is something we internalize, and we can make a choice about that. The enormous stigma part that he's talking about here in his quote, that's our thing to work on. That's society's thing to work on, to destigmatize the issues around mental health and really come around people who need our support. So in the startup world, I think of this as the perfect storm. Not just a great movie, actually a terrifying movie if you're like me, but a great analogy or metaphor for what founders and entrepreneurs go through. So we're going to spend the next few minutes talking about the 3 sort of buckets of issues that entrepreneurs are dealing with that maybe others in the business world or academic world are not. And from there, we're going to talk about how we can mitigate them and how you can practice some self-care. So let's first look at who are founders surrounded by and who are they accountable to, because one of the first things you should think about when you think about mental health is support. Who do you have supporting you, around you? And one thing that I've noticed, I've been working now for 4 years as an executive coach. That's not my primary role. My primary role is in public speaking, but I have worked as a coach. I've done a lot of pitch judging and as well as working with accelerators and think tanks. And so I have a pretty good idea. So let's take a look at the first group. The first group is your investors, if you've taken on investment. And as a founder and an entrepreneur, you may not feel comfortable talking about your mental health issues or your physical health issues with your investors because you are their investment and they have, you have their money, so to speak. So investors is one category. Second category is family. And that can be a great source of comfort to you as a founder and entrepreneur, or maybe not. I've talked to enough entrepreneurs who have said, look, my spouse, my partner is super supportive, but I have taken out a second mortgage on the home, or I've liquidated our 401ks, or especially maybe if you've taken a family and friends round of money in your early money rounds, then these people might not be folks you want to talk to because, again, they're really relying on you to make this thing work. Who else are you surrounded by as an entrepreneur? Your team. So these are the folks that work with you and for you. And again, you may not feel comfortable in talking to some of them because they're your employees and because their livelihood depends upon you as the founder with the team being able to advance the venture, to get to the next KPI, to get to the next funding round, to get to the exit, whatever it is. And so you may not feel comfortable talking with your team either. And then this is another set of folks that I find founders and entrepreneurs are surrounded by. And this one actually surprised me a lot because I do a fair amount of group coaching with CEOs and executives, as well as one-on-one mentoring and advising. And I went into this thinking very naively that perhaps founders could be great support for other founders. And in some instances they are. But what I discovered when I started putting together small groups, and again, these were private events, no investors there, there's no pitching, there's no nothing, it's just me and the founders. And I still found that a lot of entrepreneurs were experiencing some degree of puffery, right? Where it was, oh, we're about to close our next round and our MVP looks awesome, or we just picked up our first 10 customers or whatever it is. And then they meet with me one-on-one the next week. And some of them are in tears saying, I don't know how I'm going to make payroll in 2 weeks. And I just lost my lead developer and an investor dropped out. We're not sure how to close the round now. And so it was this really interesting dichotomy to me where founders didn't feel comfortable being vulnerable in front of other founders. And I think that's a real missed opportunity. And I know it's something I'm working on in my own practice to help create safe spaces for founders to be able to be truthful with not just themselves, but with their peers. To that end, I will say, and we're gonna circle back around to more resilience toolkit things in a little while, but I highly suggest that entrepreneurs and founders find like-minded support people who are not in the startup ecosystem. So they may be small business owners, they may be corporate executives, they may be all sorts of people, but the point is they're not so close to your home in that startup ecosystem that maybe you'll feel a little bit more comfortable having some professional conversations with them. And they could also lend you some perspective from someone who's not an entrepreneur or a founder. So now that we've established that first bucket, which is who founders are surrounded by and how easily it is to be isolated as a founder. Now let's talk about the second factor that you guys are dealing with, and that's the relationship between creativity and mood disorders. So there was a long study done. It was 10 years long, done at the University of Iowa, and it was done a while ago. As you can see from the slide, it was 1970s, but they followed a group for 10 years of creatives and a control group, and what they found was the following. Again, I'm not a huge fan of reading slides, but I'll just give you these stats. 43% of creatives were diagnosed with bipolar in that time frame. Only 10% were in the control group. And overall in the general population, at least here in the United States, only 1% is diagnosed with bipolar disorder. But it's more than bipolar disorder. It's all sorts of mood disorders that entrepreneurs and creatives are more likely to be afflicted by. Entrepreneurs report a 30% lifetime history of depression. Almost 30% of them also report lifetime history with ADHD. 12% suffer from substance abuse, and 23% of them come from families who are highly symptomatic for mood disorders, suggesting that there is a genetic component involved. So that's kind of the second area, right, is the correlation, and there's far more than that one study. I encourage you to go out and do some research of your own if that's something that interests you. But there are many, many studies showing a strong and high correlation between creativity and mood disorders. So now we've got our first bucket, which is who founders surround themselves with and feel like they can be honest with. The second one is that tie between creativity and mood disorders. And now we're going to move on to the final one. And this is called ACEs. And again, if I could see all of you, if we were live, I would ask you to show by a raise of hands how many of you are familiar with what ACEs are. But since we don't have that option, let me just get right into it. ACEs stands for Adverse Childhood Experiences. And I'll give you a quick background on this, and then more importantly, talk to you about how to assess your own ACEs level and how ACEs can affect you as an adult. So adverse childhood experiences. There's a group here called Kaiser Permanente, and they're a health maintenance organization. And I realize our healthcare system works very differently than yours, but Kaiser is unusual in that it is both, has the payer and the provider, meaning they own their physicians, and they also have a closed population of patients who are inside their system. All that to say, they have a great incentive for making sure that they're doing a lot of preventative medicine, and really looking out for the health and well-being of their patients before they get sick. So they started a study almost 30 years ago looking at morbid obesity, looking at the patients in their, on their rolls that were morbidly obese, set up a clinic, had great success in getting a lot of folks to lose a lot of weight, but then other underlying things came through, like depression, like substance abuse. And they couldn't figure out, if these people were losing weight and ostensibly getting physically healthier, why weren't they any mentally happier? And so they went to the National Centers for Disease Control, the CDC, which if you've been following any of the pandemic news has figured fairly prominently here in America. But they went to the CDC and proposed a study. And what they ended up doing was a study across 17,000 of their patients at Kaiser Permanente in conjunction with the CDC. And they were able to identify 10 experiences, 10 common experiences among these 17,000 adults called adverse childhood experiences. And then they began to tie data, real medical data, with disease correlation to ACEs correlation. So I'm going to show you the 10 childhood experiences that are most likely to have a negative effect on folks. And then we'll talk a little bit about what those effects look like. So they put them into 3 different buckets: abuse, neglect, and household dysfunction. So if as a child you experienced any physical, mental, or sexual abuse, those are 3 different ACEs. If you experienced physical or emotional neglect, that's 2 more. And then they have a category called household dysfunction. So if someone in your household experienced mental illness, if you had a relative who was incarcerated, if you saw your mother being treated violently at any time as a child, if there was substance abuse in the household, and finally, if there was divorce. And so they added all these up, and they discovered that if you have 4 or more of these ACEs, you are very likely to have issues with your behaviors and your physical and mental health. And I'm not going to go through all of these, although these are all on my own website and you can look at your leisure. But I'll point out a few of them that were completely stunning to me. The first one was that you have a 4-fold increase of getting heart disease as an adult if you experienced 4 or more ACEs as a child. You have a 2-fold chance of getting cancer as an adult if you experience 4 or more ACEs as a child. 400% greater chance of depression, 700% greater chance of developing alcoholism as an adult if you had 4 or more ACEs. And here's the one that truly shocked me and has me thinking a lot about the startup community. If you experience 6 or more ACEs as a child, you have a 3,000% greater likelihood of attempting suicide as an adult as someone who did not have 6 ACEs. That's a big, big number. So now we've got our factors figured out, right? Our isolationism, our tie between creativity and mood disorders, and whatever your individual ACEs profile happens to be. So let's turn now in the last 5 minutes here of our time together and talk about some of the positives. This is obviously just a transition quote I put up, but I love it. It's one of my favorites. It's from Helen Keller, and she said, "Although the world is full of suffering, it is also full of the overcoming of it." And so I find great comfort in that whenever I'm going through hard times myself. And I do think that we have ways that we can deal with these risk factors. Here's a few. First of all, where to start. Again, I'm not a huge fan of reading slides. You guys can all read for yourselves. But knowing that you're not alone, understanding symptoms and warning signs of various mental health disorders. And I'm going to show you some self-assessment, some online self-assessment tools here in a minute. Fostering a compassionate work environment, especially if you are the founder. I think fostering authenticity and transparency, maybe building team building activities that will help with that, like a Monday morning group meditation instead of meeting or in addition to meeting, or instead of a group happy hour, maybe it's a group yoga class at the office or something. And then at the end there, we're going to talk about building your resilience toolkit. I don't know how many of you remember the movie Jerry Maguire, where help me help you. But that's really the first step in this. So step one is for you to acknowledge that you need some additional support around mental health issues at this time in your life. And then the second thing that's really crucial is for you to tell just one person. If you can even tell one person who you trust, the light will begin to seep in and you can begin to form a plan that may or may not include professional help, may or may not include medications, may or may not include different modalities, but at least you know you're not alone. This does say Mental Health America, I realize that, but it is a worldwide tool. This link is also on my website, which you'll see at the end of my presentation. But this is a very comprehensive site in terms of having screening tools for various mental health disorders. So I encourage you, if you're feeling depressed or anxious, or you're just not sure how you're feeling, this is one place that you can go and really get some good beginning answers. 7 cups. So I love 7 cups. Again, if we were live, I would ask how many of you have availed yourself of their services or even are just familiar. But 7 Cups is the world's largest mental health delivery system. It's done primarily through telehealth or remotely. They've got over 200,000 trained active listeners to begin offering emotional support that may lead you down to an online community that they've formed. They have a directory of therapists that work online and in person. And then they also have 33 really comprehensive growth treatment plans based on what you're suffering with, your symptoms, that are comprised of educational and therapeutic exercises to teach you better coping skills. So I suggest you look into 7 Cups as well. We've all seen this before. You get on an airplane and they say, if you're traveling with an infant or child, put your mask on before theirs. And this relates to self-care as well. You're not going to be able to take the best care of your company, your family, your investors, your friends, if you can't take care of yourself first. So we'll just run through a few quick ideas for your resiliency toolkit, and everybody's will look different based on your beliefs and your activity level and your access to some of these things. But I strongly suggest you look into some mindfulness and meditation techniques. Again, on the resources page on my site, you'll find links to this. I will take a moment to tell you that Mind PT, which is the second one down, that is a Sunshine Coast startup. So may want to look into them first and be a good Aussie. Baths are something that are also like regularly scheduled baths. If you can put Epsom salt or Himalaya salt in there, that helps to pull out toxins and really relax you. Not quite as relaxing if you have 4 kids pounding on your bathroom door, but hopefully you can find a quiet time. And again, finding community, like I talked about earlier, finding those people who maybe necessarily don't work in the startup ecosystem, who can really support you, who understand what you're going through, but aren't also going through it. Exercise for some. Running is not my thing. You will only find me running if I'm running from a bear in Colorado. But exercise is good for some. Just be careful not to overdo it. I'm talking to ultra marathoners out there. A salt cave. This is a salt cave here in Denver that pre-pandemic I used to meditate in for an hour a week, and it really cleared away a lot of things and was beautiful. I've used a harmonic egg or sound therapy, singing bowls, things like that. You really can get very creative in what you want in your kit, and it's really very personalized. You have to find out what calms you down, what grounds you, and what centers you. So I encourage you to try a lot of these things, and then, make your little toolkit that you can carry with you everywhere. And you know that when you get super stressed out, you can pull out one or more of those tools. Thanks very much for your time. I've really been honored to present at the Spark Festival. I wish you guys a great rest of your festival, and let's connect. Here's my website.